Welcome to the weekly podcast from the Huffines Institute for Sports Medicine and Human Performance. I'm the director, Dr. Tim Lightfoot, and I'm so glad that you took the time and you're joining us here for this special podcast. As always with these podcasts in the age of COVID, we always want to start off with giving you access to information that can help you exercise safely. If you look right down here at the box, there is, at that web link, there's a whole host of resources about exercising during COVID, return to play criteria and so forth that are hosted by the American College of Sports Medicine. And so access that and get the most up-to-date information that's available. Today, we are so thrilled to have with us someone we've had before on the podcast, but given what's going on right now, especially in the sports world, we thought it would be best to bring him back on. And so I'm pleased to welcome back to the podcast, Dr. J.P. Bramhall. Dr. Bramhall, welcome back to the podcast.
Thanks for having me, Tim. Always excited to be here and to play a part in the Huffines Institute.
Thank you. Well, we're excited to have you. And I'm going to tell the audience a little bit about you. Maybe they haven't heard of you, and let them know a little bit about why we have you back on. So again, Dr. Bramhall has been with us. He is the director of sports medicine here at Texas A&M, has been that for 20 years. He's also a team physician and orthopedic surgeon here for Texas A&M Athletic Department. He's done that for 30 years now. He has a vibrant medical practice here in the local area, Central Texas Sports Medicine and Orthopedics, and I'll vouch for him because he's put me back together a couple of times, which is really great. More importantly, though, JP is widely respected across the country for his skills. He did his fellowship under James Andrews, which many of you have heard of, especially related to baseball injuries. In 2013, Dr. Bramhall was inducted into the Texas High School Football Hall of Fame for his service to high school football in the state. In 2019, he was named the SEC Team Physician of the Year. And he knows what he speaks about when he practices because he was a 4-year letterman here in baseball at Texas A&M. And I have been told that he still holds the school record set in 1981 for the most walks in a season. And so we're excited to have you. Just one trivial point here, JP. How many walks was that? Do you remember?
I believe that year I had 57 walks.
Excellent. It's great that you still hold the school record after almost 30 years now.
Is that a compliment to have the most walks? I can't tell or not.
It just shows that people aren't willing to stand in that batter's box and take the punishment that you took back in 1981, right?
Yeah.
So again, I asked you to come on because there's so much talk about fall sports and whether we're going to have fall sports or not. As we know, a couple of the big conferences have called off fall sports. We are in the Southeastern Conference, and they have decided to have fall sports, albeit on a different schedule than we've had in the past. And so there was a lot of behind-the-scenes discussions and efforts that went into making that decision. That decision was not made lightly. I know that you were part of those decisions. And I'm going to have you come on and chat with the folks a little bit about, let's first talk about the decision process. How was that decision ultimately come to? And it's still ongoing from what I understand.
Well, I mean, once the pandemic hit in March and school was suspended and our whole world was suspended, we started looking in athletics at what the future might hold. And so Ross Bjork and Justin Moore kind of gave us resources to start investigating and see what it would take for us to, number one, start getting our athletes back on campus and what that would look like. And so at that time, and still now, nobody has all the answers. But we started developing a return to activity plan. We started investigating and researching around the country what that return to activity plan would look like. We started calling upon our colleagues around and the experts around campus to help us with epidemiology of the virus and the disease, just to see what it would take to re-socialize. We started having meetings, and we met like we all have on Zoom, but we met and started developing a return to activity plan and then a testing plan. And that testing plan involved, taking tests of all the workers or all the coaches and all the staff who might be reentering our buildings as we started resocialization and returning to activities. And on, I believe, June 8th was our first day of testing, and we tested student athletes who were already here and on campus for summer school and our athletic department staff. And we also developed entry and exit plans for each building, daily screening for each building, and we gradually increased our testing so that all athletes and all athletic department personnel were tested. Even though those personnel and those people could have gone out in the real world and become exposed, we really, really tried to communicate heavily an educational plan for mitigating this disease. We encourage people to practice as carefully as they could daily mask wearing, carefully hand washing and cleansing techniques, maintaining their social distancing in their space. Just back then in March and April, we were all learning that. And so we just had to re-educate and educate and reinforce all those principles so that we could somehow have at least a plan to prevent spread and then give us a chance of reopening.
Across the SEC, I know there's been a lot of discussions behind the scene amongst the different medical staffs. How similar have the plans been across the SEC, or have the universities basically said, we'll do our own plans, and or has there been coordination?
So again, no one knew what each plan should be. And so we were pretty much individually making our own way. It was interesting as a side, Ross, after we had developed our plan and we had a system and we were ready to go, and this was, I think, in either June or July, Ross got a call from one of the SEC athletic directors, and he called to see if we could give him one of our plans so they could kind of start to prepare a plan for their school. And we had already been working on it for months. So I don't know exactly which school that was, so I'm not calling anybody out, but I'm just saying everyone was kind of on their own. And our leadership, particularly Ross, Breork, and Justin Moore, really, really encouraged us to be leaders, be proactive, and be on the forefront so that we were ahead of the game, so to speak.
So as you talked about the testing plan, give us some specifics. How often are the staff and athletes tested? And will that ramp up as the seasons come into play?
Yes. Currently, for the fall sports and the sports that are practicing, we have built functional units for each of those sports. And those are not quite as stringent as the NBA bubble, but we're trying to build in the collegiate lifestyle bubbles or functional units as we can to kind of keep the student athletes and their staff as isolated as we possibly can. So that includes, roommates, travel, practice, their training rooms, their locker rooms, almost everywhere where they live, work, and breathe. We're trying to keep those areas as decontaminated as we possibly can. And we, again, reinforce our mitigating principles to the student athletes and the staff frequently. In addition to that, those teams that are practicing for fall sports, everyone in that functional unit, in that bubble, whether it be an athletic department staff or athletic trainer or team physicians, anyone that interacts closely with the student athletes is tested once a week right now. And that is by the SEC recommended as the PCR test. And the PCR is the nasal swab that is not pleasant to undergo. So we are recommended we have a PCR test once a week for everyone in the functional unit. As those teams enter competition season and will be interacting with other teams in the SEC, we will actually go to a 3 times per week testing strategy. And each student athlete and each member of that functional unit will be tested 3 times per week, once on Sunday, once on Wednesday, and then for the traveling teams just before they get on the bus or the plane to travel to another SEC school for a competition. The third test will be a rapid antigen test, which will be more of a saliva test, not the cultured PCR test that we undergo. But all those tests are just in hopes of maintaining and not spreading any disease in between the teams or schools as we start competing and traveling in high contact sports.
It's interesting you bring up this concept of a bubble, which has come up especially in the NBA this summer. It must be challenging to get student athletes in particular to stay in a quote kind of bubble. Has that been a problem amongst the athletes? What kind of adherence rate have you heard about from the student athletes side of things?
Well, as this has evolved and as the student athletes are getting closer and closer to their competition season and their seasons, they have been very compliant. Our plan that we have set up within A&M Athletics has worked. We have very little to no spread within our own facilities. Now, they are college kids and they are going to be social, and the way our world is, we are going to contact and interact with people throughout our community. So there is going to be some disease that's going to be spread, and we are going to acquire some disease. But the way our plan has been set up for quarantining individuals that have been exposed, for quarantining individuals who test positive, all those things, we have done everything we can that once they become exposed or positive, that they are isolated. And if people will follow the rules within our system and within our facilities, the chances of spread have been really positive. We have kept our spread to a minimum.
I along this line, I was very entertained to hear one of the coaches of one of our fall sports, and I won't say which one, was interviewed on the radio this week. And his take-home message for people was, if you see any of my athletes out in public, stay away from them so they stay healthy, because we need them all year, and you want them to play all year, so leave them alone. Don't get near them. I thought that was a great message that I think, unfortunately, the public doesn't think about sometimes.
I mean, it's just a different world, and we just have to not quite have such the close contact that we all desire. And I think we will get back to that at some point once we learn more. But for now, it's very important for all of us in whatever our field of study or our field of work that we protect others along with ourselves by trying to mitigate the disease.
Now, one of the areas I think the SEC has been the leader on is this idea of the potential incidence of cardiac myocarditis in athletes that have tested positive for COVID. That may be a side effect or something that arises afterwards. Has the SEC mandated as far as testing to prevent athletes from participating that may have cardiac myocarditis after a positive COVID-19 recovery?
Well, myocarditis is inflammation of the muscle of the heart wall, and we have known that myocarditis comes about usually from a viral illness, and so myocarditis has been around. With COVID exposure, we have seen that there is a higher incidence of myocarditis post-COVID exposure. However, that has been more noted in the patients that became extremely ill with COVID and those that were hospitalized and suffered some of the consequences of the COVID illness. However, in athletes and highly active individuals, we still need to be aware of the possibility of myocarditis. And so as a result of that, we have adopted the NFL algorithm for following return to activity following COVID exposure in athletes. And that initial plan was put together by the American Academy of Cardiology. They put together the COVID return to activity algorithm. And that's a very stringent algorithm that we have to follow, or we are encouraged to follow. It wasn't mandated by the SEC. You asked that. They didn't mandate, it's not mandated by the SEC, but it's something that the SEC Medical Task Force recommended And we wholeheartedly agree that it's something we need to do to protect our student athletes. It involves several layers of test, and even for those student athletes that were asymptomatic, we still will have to follow a cardiac evaluation before they return to activity. And that evaluation requires a full EKG, an echocardiogram, a physician's evaluation, and drawing some blood work and looking for the enzyme troponin, which indicates cardiac muscle injury. So that full panel of evaluation is necessary for every student athlete that tests positive for COVID. Those that are symptomatic, even mildly symptomatic cases, are quarantined for a longer period of time, and their return to activity and their return to exercise is even slower than those that are asymptomatic. So care and protection of the student athlete for the cardiac considerations is of utmost importance.
So there's been a lot of discussion about whether to have fall sports or not. And one of I believe it was the commissioner of the SEC said that if we have fall sports, at least our athletes will be monitored and be in a better medical situation than if we didn't have fall sports. That seems reasonable to me. It's interesting how athletics is going to work hard to protect the athletes that we enjoy watching. Is any of this kind of bleeding over into the general student population? Some of the attitude about, hey, we have to stay safe to keep COVID down. Do you seen any of that as you've worked with the athletes? Are they relating stories about how maybe their families or so forth are more careful now because of their knowledge now about this and how it might affect other folks?
No, absolutely. I mean, the families of our student athletes are all in. You know, they have been some of our biggest supporters from an administrative level to help with the education of their sons and daughters and encouraging them to, follow our plan. And also, I think our world has seen increased outdoor activity of people walking, and golf has certainly flourished, and outdoor sports. I think people are understanding that a healthy lifestyle in this environment is not only necessary but beneficial.
So as we wrap up here, I guess maybe this is the hardest question. Has there been any silver linings that you've seen from all of this?
I believe that number one, we have returned to a healthier lifestyle, and it's something that we probably should have practiced. A lot of these mitigating principles of, frequent hand washing and just care and protection to avoid spread of not only viral diseases, but everything else that we may come in contact with. I think what we just talked about, the healthy lifestyle, is something that's important. I know from the practice of medicine, what we've learned is that we can communicate with our patients via telemedicine. And so I have a practice where it's a regional practice, and I have a lot of athletes come from far away for shoulder and elbow injuries, and some of their surgical follow-ups can be performed via multimedia presentation or via Zoom or even FaceTime. So our world and our insurance companies are recognizing that that's an adequate way to keep people off the roads and to talk and learn and to be able to communicate.
So as you know, because you've done these podcasts before, we always ask our guests for kind of their take-home message. So as you think about the whole COVID experience that you've had as a physician with your patients and as director of sports medicine for a major university and all the issues that have come around the return to play and return to competition, is there any take-home message that you'd want people to think about when they think about these issues?
Well, number one is that, our world is different, and the fact that we have progressed as far as we have since March over the past 6 months, we are getting ready to play sports, and we're going to be able to return and enjoy, athletics and athletic participation and competition and not quit on it, but we're going to continue to strive to get back to whatever level of enjoyment that we can with our recreational activities. And so we will eventually get on top of this. We will find a way to return to our participation. It may be a new normal, but it's going to be a way to get back. And so this is not going away, but we are going to be able to overcome it.
Fabulous. JP, thanks for being with us today. It's always a pleasure to talk to you. And for the audience, I don't know how this man keeps up with his schedule. I continually ask him about his time management techniques, but
not good.
So thanks, JP, for being with us. And I'd like to take the time to thank all of you that have been listening and watching, for being with us, for taking the time to download us. As always, at the close of all these, we always remind people to practice healthy behaviors, cough into your elbow, wash your hands, keep physical distance, wear the mask out in public. And if you need tips about exercising, which you can still do very safely, again, hit that website that's right down here at the bottom of the screen and use those tips there. And in the meantime, we hope you'll join us next week for another podcast from the Huff Hines Institute, where we talk to another interesting person in the world of sports medicine and human performance. And until then, we hope that you stay active and healthy.